Let's go ahead and get started. Welcome to the Assembly Health Policy Committee meeting of August 21, 2019. We're noticed from 12:30 to 1:30 today. And let's go ahead and start with introductions with Mr. Rivera. Would you
Felix,
start?
yeah, sure. Felix Rivera.
Austin Quinn Davidson.
Suzanne LaFrance.
Deanne Fetco, Health Department.
Michael Tierney, Health Department.
Allegra Haber, the Animal Control Advisory Board.
Natasha Pineda, Health Department.
Dean Cindy Thompson.
And is there anyone in the back who'd like to introduce themselves? Or let's just go ahead and start with you.
I'll introduce myself, Jessica Willoughby. I'm an assistant municipal attorney in the civil legal department.
And the rest of you?
Sergeant Thorne, Counter Drug Support for National Guard, here with Anchorage Health Department. Hi, my name is Nicole Legal. I am the new Human Services Division Manager at the Health Department.
I'm Tiffany Hall, Executive Director at Recover Alaska.
I'm Molly Mattingly, and I'm also with Recover Alaska.
And I'm Lisa Tucson, the Administrative Hearing Officer.
Thank you for coming. And we'll go ahead and get started with our first item, an update from the Health Department. Hopefully everybody has a copy of the agenda. And Ms. Pineda, if you want to go ahead and take us through your update.
Sure. I'll just go down our list here. Our Public Information Officer, amazing Shannon Kuhn, resigned as of a couple weeks ago and took a promotion opportunity in the mayor's office. So we're currently recruiting for a PIO.
Promotion.
She's moved on to greener pastures. We're excited for her. She's going to be able to be doing a lot of work around welcoming and equity and areas of her passion. So while we were excited to be able to keep her for the year that while I was here, so we will probably be working together with her on a lot of the similar projects. But in the meantime, we're recruiting for the PIO there. On the cemetery front, continues to be very busy. One of our busiest summers on record, apparently.
What does that mean?
A lot of people are dying. that
is what that
I mean,
means.
yeah, I think that's what he means. It's just the busiest for burials on record. I feel like the cemetery part's my favorite part of this report. July was the busiest for burials on record. And they expect to exceed the August high as well. It's been a very busy year. And it continues to remind all of us and everyone here that the spots are filling up. So if you're interested in being buried at the Anchorage Memorial Park Cemetery, you should get in your request.
So you reserve a spot
Yes.
and pay for it ahead of time?
Absolutely, yeah. So spots are filling up fast. As you guys, I think you guys are both aware, or you're all aware that the Eagle River and Girdwood have been working because there's been a concern that we're running out of space and there was a need for a 10-acre lot somewhere within Anchorage, which seems impossible for more cemetery space. But with Eagle River and Girdwood coming online, they expect some of that need to decrease. And oh,
Can I ask a quick question? Suzanne. So the cemetery is publicly owned. Is that typical?
no. I believe our cemetery is incredibly special. It was dedicated in 1915 by President Woodrow Wilson. Is that right? Yeah. And it is the only type of cemetery, I believe, of its kind. And it may have to do with the territorial days, but Rob could give you, I'm sure he'll be bringing through some code changes at some point, and we can probably do a more history on it. But yeah, it is unusual.
So it's actually the municipality that sells the spots then?
Well, they're not really sold, they're just at cost. Would you say that's correct? Yeah. It's like it's a very low cost.
That was going to be my next
It's almost
question, like
free.
whether it pays for the staff who work on that?
I know that we recoup total costs. We'd have to go into, that's a session, probably.
Yeah, that's sort of interesting, why are we subsidizing the cemetery if we're not recouping our costs? Is there, there might be some public policy reason we're doing it, but
I think
seems
it's
like
the
we should
way it
talk
was
about that.
established. I think the way it was established and transferred, but I can't say for sure, so you can answer But when we do the code,
It's been
we could plan on just doing a lot of deep dive into the cemetery.
Sure, when we do what, sorry?
Their code, they have some code changes coming, so that'd be a good opportunity.
That would be great.
Because I haven't dug into those code changes either, so I don't know how controversial they'll be or not.
Okay.
He wanted me to make sure that you guys knew that in May 30th of 2020 will be the dedication for the bell tower project, which is underway right now, but they'll be doing that dedication next year. In the admin division, we're working pretty closely with the fire department to transition the safety center to new computers for their vehicles that would work better with our, the AFD equipment for communications. So that is underway. You guys already know we executed that agreement with Catholic Social Services to operate Brother Francis Shelter. Let's see. We're completed on our 9 state grant awards are approved, and they'll be coming to the assembly for approval by you, hopefully in the next meeting. September 10th is when we anticipate bringing them forward to you. We launched a Tobacco 21 webpage and worked with the local nonprofit partners on signage and press conference and got all of the, we're able to, Deanne worked tirelessly to get an email list for all the retail providers, which was a little bit more challenging than we had anticipated, and we're able to communicate to them about the new signs and any FAQs or questions. So we think that would slow down. It was a little ruckus last week, but we're looking forward to that kind of moving on into normalcy. Obviously, we'll talk about animal control today, so I'm not going to go into that too much, other than to let you know that the next advisory, the Animal Control Advisory Board meeting is on August 22nd at 5:30 at the Animal Care Control Center if you're interested in participating. The emergency preparedness section had participated in augmented services during the Anchorage Mass Care response. The team is was working closely with the activated Emergency Operations Center, but now that has been kind of separated from that work and have moved back into their normal operations of training our health department staff to be able to respond to emergency. So they're back to, I guess, their normal operations. Childcare licensing, you'll be hearing from them in September, along with public health nursing, on their information on provider vaccination research and their surveys that they completed with all of the providers, so I won't spend too much time on that. The Community Safety and Development Team, which is our group that oversees the HUD funds, will be launching the 2020 action planning process this week, so you'll see public notice for that. They will have their first public comment meeting in conjunction with the HAND committee, which is what they typically do. So if you're interested in providing any comments, that's the place to do it. We're wrapping up a Housing Trust Fund RFP that's out for about $700,000 for projects. And we're currently recruiting a supervisor for that section, and then I think once we have that person in place, we're fully staffed on our supervisory and management team. Senior, the ADRC, basically the big news there is that they wrapped up their year and they provided a bunch of end of year data, but ultimately they served 5,824 clients last year with information referral option counseling and utility assistance, along with administering the HUD Emergency Solutions Grant, and provided housing supports to 35 individuals and households. Community health nursing has been very busy. I don't know if any of you guys went to the Fairview Back to School and Health and Safety Fair. We served approximately 1,200 people and gave out lots of vaccinations. There was quite a big partnership. There was more people there than historically, so they're really making that event better each year. They're working again with the Alaska Youth Advocates, different clinical services via the mobile clinic that we have. To their youth drop-in center once a month. So we're happy that all got disrupted when they moved AYA out of the transit center. So it's taken a while for us to get that partnership put back in place. So they're moving on that. Environmental Health Services is very busy with air quality and the regular busyness of summer, and they are just incredibly busy. They work Saturdays and there's just more of a workload. And the air quality issues have made it a little bit harried as well. But they're continuing to do good work there. The WIC program, the main thing, I don't think I reported last month, is we got a grant, so we'll be able to bring on a new employee to work on the SNAP Ed, which is an outreach and education position to bring more services to people in the city. The wrap up on budget impacts, I just wanted to reiterate that the ADVSIP program was never restored, so that's a permanent cut as far as we're concerned going into the future. Alaska Domestic Violence and Sexual Assault Intervention Program, so we'll continue to operate that program with the $450,000 that we get in operating, but the enhancements that have been included for the last 10 years or so from a state grant, which was about $300,000 a year, was cut. So I could, yeah.
Yeah, thank you. Could you speak to those enhancements, what exactly they were?
Yeah, I took them out of this report. I could email you specifically what they were, but essentially the money went to 3 providers in town that would help triage out of town clients. So it was Awake, Star, and Victims for Justice. And I believe Victims for Justice completed expert testimony in cases. So the $10,000 that they were getting was cut, and then the service providers had resources that they used for out of town people. So there's about 100 folks that have been provided services over, I can't remember if it was 3 or 6 years, but those people will no longer receive those services. And but the main things will stay in place, which is the police officer, the clerk, all the basic mechanisms that we pay for already as a city to make sure that offenders are held accountable to any of the flags that are in the system. So that will continue on. It just won't have, there just won't be as many services.
Thank you.
Can I ask a couple? Sure. So no uni staff will be laid off as a result of that?
No.
Maybe at the receiving entities, but we don't know.
We did, we cut we no longer provide the funds that were coming through that state grant to those 3 agencies. And I can tell you the exact amounts. And that's, they've experienced that cut, that cut is done.
So those folks go who are working on those
Yes.
programs, and they won't be providing services.
Yes. Yeah, so, Awake ultimately got a big hit across multiple ends because they got cut there. And then I'll talk a little bit more about what got restored, but they still just had enough cuts. That one was a total cut. The HFC cuts are about an 20% cut, but in total, those kinds of, when you're braiding funding, they just have an adverse impact on an organization. I don't know how they'll put that back together. So I just wanted to make sure everybody understood that we see that being gone forever, and I don't know what the plan forward would be to try to advocate for it to go back in somewhere in a future year. As you probably heard, the Human Services Community Matching Grants was restored to 2.2 million-ish. That included Human Services Matching and Community Initiative grants. Once we receive notice from the state what portion of those funds are coming to the city, then we will notify the grantees. We've let them know that yes, we're aware that it was restored. How much will actually come to the city, we're going to wait until we get that communication directly from the state, and then we'll communicate to the providers what they will get. The one area that there'll be some exception, and we'll be meeting with Catholic Social Services, is to address what services Brother Francis Shelter will provide with those dollars, and whether that's going to be case management or day services. So we'll make some changes to their award, but that is what we'll mainly anticipate changes on. So we'll let you know if we anticipate full funding, but we don't want to commit to that just in case. The other cuts that I thought you might want to know about were I know we talked about it a little bit earlier, was the Homelessness Assistance Program. So that $3.6 million cut in our system actually equated to $502,000 in Anchorage. So HFC provided us with the funding, how they're going to fund it. So there's 1, 2, 3, 4, 5, 6, 7, 8, 9 agencies that receive the HAP funds, the Homeless Assistance Program funds, and all of them will get 81% funding. So they all got 19% cut across. And I can send you the chart of what that exactly looks like, but I thought it would be of interest to note that in total, for that $3.6 million cut, we're only gonna see 502 of it in Anchorage. So I'll send you what we got from them, just so that you have that information. My only last thing I wanted to address was the health department's monitoring of infectious disease. We've received from Felix, but also there was a previous communication that came from a community council that was concerned about infectious disease being spread widely throughout the city. We're working on some briefs, and we're happy to speak to it in more depth, but we wanted to make sure that you know that the health department already works closely with the state and in certain cases with the CDC around infectious disease. That's our function, that's part of what we do. We looked at all the different diseases that these councils are concerned about, and I just wanted to let you know that we've never had plague or typhus in Anchorage. There's been no reported cases of that ever. In 2018, there were 2 reported cases of typhoid fever in Anchorage. One person became sick after they traveled to Burma. The other developed the illness while they were traveling in America Samoa. There's no cases of typhoid fever in Anchorage. The other point I wanted to make is in one of those letters, there was a comment that typhoid fever could be passed by just by having contact with somebody or touching something that that person had touched, which is not accurate. Typhoid fever is passed through ingestion of the actual bacteria, which primarily comes from fecal matter. And so you would have to ingest, drink, or eat something that had that bacteria on it. So it's transmitted that way. I'm not just gonna get it by touching something. I would have to touch that bacteria and then ingest it into my body. So I wanted to make sure that was clear. Tuberculosis is our bigger ongoing challenge in Anchorage and has been for 100 years or so now. We see very rare cases of hepatitis A in unvaccinated persons returning from out-of-country travel. Hepatitis A is another disease that people get worried about related to being transmitted from human waste. But at this point, we've had no reported cases. And many people in Anchorage and elsewhere have an unrecognized hepatitis C infection. Most can be cured with treated regimens if they can be identified, and that is often passed intravenously. So at this point, we're monitoring all those diseases, and if there were a situation where we felt there was something to be concerned, I just want to make sure that the Assembly understands that we would be issuing a public health alert, and we would be working closely with the state and the federal government. And that is the end of my report.
Thank you, Ms. Pineda. Mr. Rivera?
Yeah, thank you, Madam Chair. So, thank you for that update. And I haven't had a chance yet to review the documents that you've sent me, but I will. And, hopefully, whether it's September or October, we can invite those other players in the room that are a part of this issue, because I understand it's not necessarily a health department issue. There are state players and federal players who are part of this. And, would love to get a sense of one of the recommendations that was in that resolution, which was sort of a multi-agency approach of how we can deal with this. So we'd love to do that sometime in the future.
Yeah, and I think that the infectious disease triggers that to happen, but the idea of wanting to prevent it is a totally different. I think it would require probably multiple different departments and everyone's commitment to reading the research and understanding, what the threats are. Currently, our water is not contaminated, our drinking water. So there's a low-level threat from our perspective, but it would be helpful to have all those other departments in the room. And the DEC at the state is actively involved and understands the issues with that waterway, and so that might be a useful discussion. I just don't know where the right setting for that conversation is. But our commission was presented a similar resolution from Rogers Park Community Council, and they at this point haven't taken any action on that resolution. They wanted a support letter to get some EPA funds for a group to do research in a particular couple of spots. I think we lean towards wanting, an academic body or an unbiased entity to conduct that research. But that's as far as we've gotten.
Thanks. We've got a question from Mr. Gates.
Yeah, thank you. Mr. Pineda, I'm sorry you missed it. Last month there was, I guess, measles infection showing up in Lehigh. Is that one from none in Anchorage?
Yeah, none in Anchorage, and there's no other cases associated with that case, which is unusual. But at this point, there's been no other reported measles cases.
There was a few, I guess, in California.
Yeah.
Was that right?
There's a lot, and there's over 400, I think, nationwide. I could be wrong on that number, but there's more than we've had in a long time. There's reason for caution. Although the state epidemiologist thinks that our rates of vaccination are high enough that we're not going to experience a large outbreak in Anchorage, but we're still alert and monitoring. Yeah.
Thanks. That's reassuring given our earlier conversations about our community immunity in Alaska being a little bit low,
Yeah.
but in Anchorage,
Well, it's the MMR is the vaccination that covers measles. The MMR is excellent for measles, not for mumps. It has there's a requirement for some people to get the booster. That's why we have the mumps issue. But also there was a large unvaccinated population that was highly susceptible, but in general, he's less concerned about measles.
Isn't MMR measles, mumps, and rubella?
Yeah.
But it's
the
not good
mumps-
for mumps?
The mumps portion of it, there's something, you'd have to ask him, he described it to me and it's less effective. So it required boosters for people who are at risk for mumps.
okay.
So we talked to them early on when the outbreak was starting in Oregon about whether or not we needed to do any work, and I think we all agreed we would just do coordinated communication and education, which we've been doing. There's lots of flyers and social media, and continued open vaccination, immunization clinics, taking those like we did in Mountain or in Fairview at the rec center last week. But there's just less concern.
Thank you for the update. Any other questions before we move on to Title 17? Okay. And first off, thanks to Ms. Quinn Davidson for getting the working group set up and the work on behalf of the rest of the team too. And Mr. Tierney, you'll go ahead and take us through about the discussion.
Absolutely, and I do appreciate, specifically Assembly Members Quinn Davidson and France for participating, members of the Anchorage County Patrol Board, legal, and more recently the hearing office, and some very interesting conversations the past 2 days. But you should see an S version in front of you there, and these are things that had came up from the last policy committee meeting. But on page 3, on line 7 through 25, it had been recommended that we delete all the examples of inadequate shelters. And in doing so, the work group wanted to make sure that anything that we deleted, that we covered it up in the definition of a dog shelter. So we added in three additional statements there, that the area would be free of surrounding debris or other material that can endanger the dog, that the area is designed for the purpose of sheltering if used for long-term confinement, and that it be constructed of materials to provide protection from the elements.
Can I add something, Mr. Chin?
Yes.
I just wanted to point out, Mr. Dyson isn't here, but if perhaps he's listening, that number 7, there was some discussion about whether being designed for the purpose of sheltering, if you had a structure and
You
you
could
put it out,
absolutely repurpose.
you could repurpose it, and so that would be included within number 7.
Correct, absolutely.
Thanks.
Yes. Okay, if there's no questions on that, page 6, on line 36, this is more administrative. We realized that we had taken out the map of we had said let's take out C attached map. We actually had to line in, take out the actual map. So that's all that does. And then on page 12,
And the changes you're highlighting are just the changes in the S version from when we last met.
correct. Page 12, this is where we spent a lot of time discussing the bond. And if you want to get into the whys and the where-nots, we could, but we're actually changing that from bond to actually billing every 30 days. And so as opposed to them putting a bond based on future projected costs, we're saying at the end of 30 days, we will bill you for actual costs, which would be the boarding and the medical care, and we will do this every 30 days. And then if the owner fails to pay within 15 days of receiving the bill, then the animals are forfeited to the municipality. It's just it's a lot cleaner, I think. And so everything from 2 on down is eliminating all the language that we put in there for bonding.
Can I ask a question about that?
Yes.
So before, the concern was that a dog, or would this ever apply to other animals, or is it always dogs? Another animal?
It could be cats or
Okay.
birds or.
Yes.
But that animal would go into protective custody, and then, maybe there's some animal cruelty charge, and so over the
Right.
course of a year, the dog is stuck in the
Absolutely.
custody, and then at the end, the owner says, "Oh, I don't want to pay that anyway. I relinquish my dog," but then the dog has been in custody for a year and maybe had
Correct.
some, mental. I mean, any of us, if you're in jail for a year, it's gonna start feeling a little weird. So, the point of this is now the dog would have to be there for 30 days, and then the owner would have the opportunity to pay. And if the owner didn't at that point, the dog would be relinquished.
Correct, because the debt accumulates annually.
Yeah.
So now we're just saying, every 30 days, we're gonna bill you what is owed. And if you don't pay it, you run the risk of, it says shall, so you
Yeah.
shall forfeit your animal.
And there would be a hearing, an opportunity to request a hearing on that forfeiture.
And this is only when there's an animal cruelty charge, or has it gotten broader since we've?
No, this part still is the animals that are subject to chapter 8.55.
Yeah. Okay. Great. When this goes forward as an S version, will you all be writing or could you write a short memo that just describes the differences since we last met so that the assembly?
Crafting that now.
Okay, awesome, thank you.
That's okay. And then on line 32 is where we have, let me back up. On line 26, we did add in the word fines because we had taken out the part about anything not covered by the bond, but at the end, when they do redeem the animal, they have to pay any outstanding fees, fines, and costs. So this just stipulates the fact that the fines are included if there was any outstanding fines. And then on line 33 is where we added in the verbiage or forfeit on page 13. I'm sorry, yeah. And this is where it talks about that they have their legal recourse, that they can request a hearing. And it references section 1705-100, which covers the whole hearing process. In fact, you have 15 business days, which will be scheduled within 20 business days. You have 20 days to render a decision after the hearing, so that's all already covered in the code.
So question,
Yes.
that section starting around line 32, 33, where it says, or forfeited animal may obtain a review of that disposition, that means a hearing?
Correct.
And then that reference to 1705-100 is where you go to find out the specifics
On the hearing,
on the
correct.
hearing. Okay. Oh, Mr. Gates?
Yeah, I wanted to ask about that as well. Does this mean it's sort of an administrative decision by operation of code that the animal's forfeited and the owner doesn't do anything and that's the end of it? Or does it automatically go to the hearing officer for hearing?
It is
Does the
not-
person and owner have to request after you receive?
They would have to request a hearing.
So for that, then appeal.
They would have to request a hearing within 15 business days. And that's going to be part of the protocol anyway. When they receive a notice that, hey, you haven't paid and you're going to forfeit your animal, we'll give them all that, here's the number of the hearing office, you have 15 business days. So we'll make sure that they know what their legal recourse is.
Thank you.
Can I ask, sort of related to one thing we dealt with even without a code change, I think,
Right.
but was making sure that folks could foster the dogs who are in protective custody. That's still a possibility, right?
It is. There's nothing in the code that prohibits you from fostering a dog in protected custody. Of course, the way it's going to be is the chief animal control officer has the right to determine whether a dog is fosterable.
Right.
Some are way too aggressive for that, but we've already constructed a form. There's a foster application, and now we have what we call a rider. If the dog's in protected custody, you can list all the requirements for that, and you sign that as well.
Mhm. But now that some dogs would only be in protective custody for a month, it takes lessens the need for some of those foster homes. Right before, you might have had several dogs for a year or more,
Well,
but now.
That is correct. It may become less of a need now.
Yeah, depending on if people choose to pay the.
Correct.
Okay, great, thank you. I'm so glad you guys are able to do that. That's great.
Oh, it's
So, I'm sorry, actually, just so I'm clear from what you're saying, Ms. Quinn Davidson, about the fostering piece.
Yes.
So then, if an animal in protective custody is fostered, then will that person still be charged every 30 days?
They will. There's
will.
$14. I mean, there's still an administrative burden, as well as the fact they provide food to the foster home.
Ah,
Any
okay.
veterinary care, we wouldn't expect the foster home to incur that cost.
Okay. And I'm sort of bringing up something that before, what was it, 6 months ago or something, we talked about this because there were some individuals who wanted to foster dogs who were in
Right.
protective custody, and Michael, maybe working with Jessica, I don't know if you,
Yeah,
they were able
very
to
much
say,
so.
yeah, that's okay, we can document anything we need to about the dog, and then we have a process, and then, because of course after dogs are in protective custody for an extended period of time, they become less, there's a lot of problems that happen, harder to adopt out, so.
That's true.
Anyway, they made it possible for us to be adopted.
Yay, good work on that.
Okay. And that are the changes. The changes we made. Any
Great.
further questions?
I mean, this seems very straightforward, which kind of worries me. Just because it's hard to, I'm looking at the chair. It's hard
Come and
to,
say anything.
it's hard to, no,
No,
just
kidding.
as far as it's hard to predict, right?
Sure.
Especially when, time passes, what kinds of issues could be raised and everything.
I mean, if I may, I think the resolutions that were found in this working group, I think will allay the concerns of the members, and they seem very common sense, very practical. So I think that this is fine. I don't know if, I think with the attachment of an AM, I think the members will be fine. I don't think we'll need to do any more work on it.
And then there was the other communication that was sent out regarding Mr. Dyson's
I
question.
had some concerns. I think specifically was wondering if we ordinarily just send everything out to the veterinarians in town. We don't have an email listing or a chain of that, but Dr. Wilson, who manages the shelter, is a licensed veterinarian, has been for many years, and so she does review it. And I say they don't. If they happen to be a commercial license holder or a multi-animal license holder, and that's what we're addressing, then they would get the communication just because of that fact. But I did call the veterinarian, Dr. McGregor, I believe was his name, left him a few messages telling him I would be happy to discuss any concerns he had on wolf hybrids. I think that's a miscommunication because we are removing that from the code, as well as let him know that we have an opening for a veterinarian on the animal control advisory board.
Great.
Is that right?
Yeah. So did you have, I know you don't have a vet on the board, but
Right, correct.
you did say you had a vet you had worked with initially to work on some of this language?
We've had veterinarians in the past. Oh,
Were you able
Dr.
to
Myra
run-
Wilson.
Great.
Yeah, she's a veterinarian.
Were you able to run this language by her?
Oh, absolutely.
Great. So I think that'd be something to include in the memo,
Great point.
just to make sure. Fred
Yeah, and we
feels-
did circle back around with Member Dyson, and I
Great.
think everything was resolved, and there was some confusion about the reading of the changes.
Yeah, I think they were on the same page about the wolf hybrid,
Yes,
that it doesn't
yeah.
exist, right?
I
Or
was
that
just,
we're not-
I was
yeah.
just reviewing it and understanding that what the brackets meant.
Totally, and it's totally confusing because it's all this bold and weird stuff. Can I ask a question about C1 on page 12, the second sentence, which says that payment of animal care is not dependent on the outcome of Chapter 8.55 charges?
Yeah, so that is also current code with other charges of 855. Basically what that means is if you go to court,
I think I get what it means. I actually was
Yeah.
gonna ask Dean to talk about whether that's okay.
Which sentence was it?
It's lines 19 and 20 on page 12. Right, Michael, means, you get accused of animal cruelty, but you're found not
right,
to have done it.
even if you're
Yeah.
acquitted, you owe those charges. For
I
the
just wanna make sure
care of the
that's
animal.
something we can do.
I think it's okay.
Okay.
I think it's a separate sort of charge for the care, and the criminal charge, whoever commits it, is separate. So I think that's
And I guess you worked on that too, Jessica. I forgot that. Yeah, sorry.
The analogy that's been given is if your car's impounded, and the criminal or the moving violation is eventually overturned for whatever reason, you still have to pay for the tow and the lot fees. That's the analogy. You still have to pay for the care of the animal.
Seems somewhat unfair, but don't know what to do about it. So, okay. If it's legal, we'll stick with
It's
it.
where music collapse, in the towing and vehicle context, there's a separate civil case about the towing and impoundment and charges from the criminal case. There was a DUI or license to go or something. Two separate proceedings that sort of overlap.
And then if you're found not guilty or however that turns out, there would be nothing to request a hearing over, right? I mean, if you wanted to challenge the fees, you couldn't really
Yeah,
do that.
unless the decision from the court addressed that,
Mhm.
say that they were waiving it or something.
Okay. Good point.
Okay, great. So do you know what your timing is for, you're gonna introduce the S version as a new ordinance?
Mr. Yates? We have it on for September.
For Rob talking about the ordinance, something like you were talking about. I wondered about the off-leash dog park spaces. So we're taking out listing in municipal code, which means you have to add named parks by an ordinance and so forth, that process. I see there's already a process, the Animal Control Advisory Board, and the mayor's recommendation. Now it's recommended by the advisory board, the Parks Rec Commission's concurrence, and the mayor, subject to approve consent. But those will be listed on the website. But how do you see that coming to the assembly for approval? Is it by the assembly resolution saying we're adding this park? And do you think that's sufficient public process for the neighborhoods in the vicinity of the park to come in from making that outreach?
I do, because this code is really, the park would have already been established. We would just be now updating the code to show that there's another park. And this was just to avoid having to update Title 17 every time a park is established.
You would bring it to the assembly as an AR, and there wouldn't have to be a public hearing in front of the assembly.
Parks and Rec would, but they would come to the Animal Control Advisory Board first, just to get their input.
Are those going to be noticed, and the Animal Control Advisory Board knows the public about the specific addition of a park or removal of a park from this list? I want to make sure there's enough opportunity for the public to be noticed and to hear and comment on adding or removing parks.
I can check with Parks and Rec, but I think Steve Rayfuse would handle that notice, and they usually make it as part of a community plan.
So it's a Parks and Rec function.
Correct.
But Parks and Rec brings it to the Animal Control Advisory Board
They
for
do.
approval at the end of the process?
They do.
Is that
We
right?
usually do a
Somewhere in the
resolution in
process.
support of.
Somewhere in the process, I
Right.
would.
We're having
Sometimes
tough-
it's earlier, sometimes it's later.
Sometimes after the fact, but most of
Okay. Okay, great, thank you. This is on the agenda for September 10th, correct?
That's correct.
Okay. And at least one of you will be there and to speak?
And can I ask, if it's on the agenda September 10th, so that was because we postponed
Right.
action on the initial item until September 10th. When will this be introduced though? Because if this is an S version, we need to have adequate time for the public to digest it. So I would assume it'd be introduced on the 10th, right? So wouldn't we then have it held in the next September meeting?
No,
We can-
S
or can
versions
we-
don't have to have their own introduction, but we can make sure that the S version gets included on the regular agenda for the
Okay.
next meeting.
Yeah, that would be good, because that's at least a week, a little over a week before, right?
Mhm.
Okay.
Thank you all for the work you've done on this. Very much appreciated, and appreciated being involved in those conversations. I think that's a great way to do public policy, have so many stakeholders and experts included, so thank you very much. We've got a little bit of time left to move on actually to item C, continuation of the substance misuse discussion.
So
Wanna go?
my plan was just to do a verbal update. I had grand plans of actually having a graphic done and designed with updates on the 10 actions that we recommended, but I didn't get that done. But I
Can I
can
ask
give
you,
you.
Natasha, before
Yeah.
you start, just because I know Tiffany and Molly are both really interested in this item, and that's why they're here, would you mind just giving a little background on what we've done over the last couple months and working with Sarah and the report
Yeah.
that was prepared and all of that? And maybe you all know about it already, but.
Yes. So in June, we released the substance misuse assessment, which was the culmination of about a year's worth of work by a fellow that was working in our office, and she completed an on-the-ground assessment of all of the locally available data and some state data. So that's available in a full-size report, which I think everybody in our audience actually has.
Okay.
But there was also an executive report that included 10, what happened, and I don't know if they were here when we presented that, was that we took the 20 recommendations to the Health and Human Services Commission and did some analysis with them and categorized their top 10 policy actions that they would like us to work on as a department and an assembly and city. So they recommended 3 areas, basically 3 things that the Anchorage Health Department will do. There's 4 items that the Anchorage Health Department was going to recommend that the Anchorage Assembly undertake. And then there were other policies that they felt were really important and needed to be in the prioritization, but weren't necessarily going to be worked on immediately. So I can report up on some of the things that the Anchorage Health Department has done and the status of a couple of items have changed, as well as where the recommendations from the department to the assembly are in process, if that's helpful. And then hopefully, because Sarah is gone now, so that work's largely being conducted by myself, and then our National Guard representative, which I believe we introduced at the last meeting, but if we didn't, do you want to reintroduce yourself and tell them a little bit about what you're doing with the health department this year? So we have a year commitment with the National Guard.
Sure.
Do you mind, Jen?
Sure, yeah, so I'm basically helping with their prevention capacity any way I can, so providing logistical support, outreach. So I've been at the public library helping educate folks on Narcan and naloxone and the medication disposal bags, alongside the social worker there from AHD. Also helping the state of Alaska's Rose Map, and some of their initiatives are the state opioid action plan. And a lot of my background is from treatment, so this is a whole new arena for me on prevention. But it's been good so far.
So we have her all year, which is wonderful, and you were also working on the housing, are you doing housing lab?
Helping on the housing lab, we've vetted Narcan and some other prevention efforts and lead issue treatment.
Yeah, at the library, so doing some hands-on field work,
And you full-time doing this?
Mondays and Tuesdays.
Mondays and Tuesdays at the health department,
Yeah.
Wednesdays and Thursdays at the state of Alaska.
Wow.
So it's a shared.
And does the National Guard just provide a person to do that kind of work, or how did that
It's one
come to
element of
be?
the counter drug support program. So counter drug is mainly law enforcement, so we have folks at the DEA and FBI, and then we have one portion of the program where we support the community in
And last year, we started that relationship when we launched doing the substance misuse assessment. So the Office of Substance Misuse and Abuse.
Substance misuse and addiction prevention.
Thank you. Awesome. We started working with them, and we started that last fall. So we had a different officer with us for the year. I think we might have met him a few times. He helped do the substance misuse assessment, and we were very happy and pleased that the National Guard wanted to continue that partnership. And each year, this year, it looks a little different than the relationship last year because each person brings different talents and skills and areas of interest. So I think it's been really great to have that support over there for Rebecca as well, just so she's not an island working on big issues over there. So I'll just do a brief on a couple of the highlighted items. And I will work to have an actual document for you next time. There were 3 things that we stated in the report that the health department would do. One was to enact a policy for Narcan distribution at the Anchorage Health Department, and we were able to get that executed, I think, in July. We actually got an approved policy and our distribution site, and there's people on every floor that are trained and tasked with being able to distribute Narcan if somebody came in and wanted it. We're also distributing it at events that the public health nursing team is doing, so that was helpful. That took us about a year actually to complete. So
Is that at City Hall primarily then?
no, just the health department.
Oh,
Just at the health department. So I can't even imagine what it would take to have the City Hall be a Narcan distribution location. I don't think that would happen. But we still continue to have the direct disposal bags available at City Hall and other locations. The other item we said we would do is enact a screening, brief intervention, and referral to treatment policy of the health department. I believe that is in early stages of planning, and that will happen within the community health nursing team. So they will be undertaking work around that issue. And then we also said we would officially indicate our support for maintaining current alcohol outlet sales hours, explicitly stating our opposition to increasing hours. And we have a draft. It is almost done and most likely be able to have that recommendation finalized in the next month or so. So you could see that recommendation coming from us.
Can I ask a question?
Yeah.
So that, but before the assembly, that came before us last year or early this year, and it failed. So are you under the impression that there's some desire to bring that back, or is this just sort of to have a policy statement that discourages maybe
Yeah.
assembly members from doing so? Okay.
Yeah, I think that's the intention of the recommendation.
Looks like one of
Yeah.
our audience.
I was just gonna say, also it only failed because the alcohol tax failed, but it passed the assembly.
I remember that. I remember Mr. Trainee's.
And there's just a lot of research that indicates the negative impacts of increasing hours of operation. And so we are condensing that all into a 2-page policy statement, I guess, at this point, because it's not an actual ordinance at this point. We won't be making a recommendation, but we will be making a statement that we don't think we should be increasing hours in our city. We already have enough of a burden with our current outlet density and hours of operation that just adding to that doesn't make sense from a public health perspective. So we'll have that soon.
Can I ask you before I forget
Yeah.
about another thing that's related? So Forrest and Chris have brought forward a proposal to put the smoke-free ban before the public. And I have serious concerns with that. And I'm wondering if the health department is going to weigh in. It's sort of accelerating along. Do you know when we're voting on that next meeting?
It's going to be, the public hearing is September 10th, yes.
I haven't conferred with my boss yet, but I mean, we supported tobacco 21 and clean air, and I have my personal opinions, but I don't know what position I can take as the director of the health department.
Would you be comfortable trying to evaluate that and, if possible, producing a memo or position prior to our September 10th meeting? Thank you.
Fine.
And another question too on, I recall from that long list of policy directions, changing the phrase from substance abuse to substance misuse
Yeah.
was something too that the department was going to undertake? Or?
Yes. Yep.
Okay.
So it is one of in our top 10s, and essentially I think that's going to look more like action to have them
Okay.
make that change. It's like when they changed the name of our department. So on my update here is I simply just haven't gone and researched what mechanisms are required. Is it a memo? Is it a, what that form will take for us to ask for that to be changed throughout and then into the future in all municipal communications.
And that's something we could probably research too on our end. Okay, thanks.
So that's the next list was what we recommend you do, which was number 1 to enact a tobacco 21 ordinance.
Can I just move to extend for 5 minutes so we can wrap up?
Second.
Sure.
The second item we had was that we recommend a 5% retail alcohol sales tax to the ballot for voter approval. We also recommend changing all official municipal language regarding substance misuse to be in line with recognized best practice, and then allocating funding for the Alaska Center for Treatment Projects. So the third item just requires a little bit more research on my end to figure out the right way to help execute that recommendation. The treatment center funds, there was a $10 million item in the capital budget that was cut. And so at this point, I'll be meeting with our team and then also with Bill and others just to assess the treatment center project in a situation where there's a lack of public funding for such a treatment center. So we'll
What was it again? Explore treatment center options or
Well, this one
something?
is allocate the funding for the Alaska Treatment Center, and that was based on anticipated, state grants and other funding to fill the $14 to $17 million delta in the development costs.
Mhm.
So there's just more to come on that. I don't have a solid answer of where we are. And then we passed the tobacco 21 ordinance, and there's a variety of other. There's 4 other items that were important and posted, but we haven't taken any action on them, like allocating funding for provision of free and inexpensive extracurricular activities for youth. That would be really something that would happen if we had an alcohol tax and there was a prevention carve out of 20% or something like that, and we were going to allocate that to prevention funds. So some of them, as I develop a graphic, I guess, to chart our progress over the next 12 months, would be contingent on funding that, is not yet in place. So that's my general
Great.
update.
Thank you. So with those, you'd probably just be coming back to us as appropriate, but there isn't some grand presentation that we need to do. It's just sort of as we have time or funding or whatever
Yeah,
else,
we'll hit these,
we
but-
can support you.
Yeah, but I'll create some sort of dashboard so that
Cool.
we know where we are, like this is completed, this one's on hold, this one's in progress, so that you have some sense of where we are and that we don't lose track of them.
Great.
And I feel like as a committee, we should take on changing the abuse language to misuse, because that seems like we could probably do it fairly quickly and it would start that or continue that conversation or spread it about, how important it is, how we talk about these issues.
So it would be just in code language or in any muni. I mean, you all probably direct most of what is coming out of the muni with relation to that, I would guess. Maybe not homelessness.
It's probably all over. I didn't do a code search. I could do that. That could be a good start. Just search it. Oh, he's already did it. I knew you. I could just feel it happening.
Did you just apologize for doing This is the kind of lawyer you want.
Substance abuse in dog homes, so we need to know
Yeah.
ways to change them and then trickle down to the rest of the administrative materials that are government.
Okay, well, I'd be happy to
Yeah.
sponsor. How about you guys?
There you go. You've got 3 people.
Okay.
Yeah, can you add that to your list, Dean?
Yeah.
So one of this fraud and
No.
No.
No, we would not do that to you. Not these 3 people.
Never. So, well, thanks for the update, Ms. Pineda. And actually, we started a little bit late. We extended.
Oh, right. I'm sorry.
Well, no, it's good to extend. And is there anyone here who would like to speak? Anyone in the audience? Nobody? All right, well,
Could
any
we,
other?
before we adjourn, while we're all in the same space, could we then talk about sort of how we want to do September and October's meetings? I know there's the vaccination issue, which Natasha and her team have been looking into requiring that daycare providers be vaccinated. And then there's the issue with either water quality or I don't know if there are other aspects to the fecal, I don't know what the right words are. Yeah. Are there other things that we wanted to consider doing in September, October, or though should we pick one of
Yeah,
one of those to
September,
do
I
each of
think
those months?
the childcare licensing one, they'll be able to pick a full meeting. 'Cause basically
Okay.
everything that they've done the research, they completed a survey, they have proposed, they're gonna have to propose code changes if that's something that wants to be pursued, which would also have to be preceded by at least 6 months of meetings with the providers. And so I think the sooner
We should get going on
deal
that.
with, just let them present it to you, let's decide if we think this is critical, move forward, and then let them begin their exercise, because I think it would take them a while.
So could we plan to do that in September and then the other issue in October?
Okay, that just helps, because then it gives us enough time to actually pull the right
Yeah,
together.
instead of the week before trying to decide.
When are the next Title 17 changes coming forward?
Are there other Title 17 changes?
You mean the next, the animal
next
control?
round.
You mean those
Yeah,
other
the
things we
next
talked
round.
about?
Those will take
Yes.
another year, right? At least.
Hopefully not.
Everything
It
at the
takes time.
discussion stage, yes. So
Got
there's
it.
agenda items that we are
Okay.
looking through.
Great.
Yep.
Yeah, because you'll see from us, we'll see the childcare licensing code would have to be amended, and then, the next set of animal control, and then the cemetery.
Oh, cemeteries, great. So maybe we do that next or something.
I mean, in November.
But we'll stick with immunizations for September.
Yeah.
And then I thought I heard earlier in the meeting that it wasn't clear where the Triscable, did I say that right, waste conversation fit because of the state, but we've got time to work that out, whether or not it's here or in another, okay. Can't
Just
imagine
touches
what other.
multiple departments
And I guess for that meeting, we could just invite people from different agencies to.
Yeah.
Could you, are you the
I
right
can
person,
help.
since you know who those
Yeah.
people are, like maybe saying we're thinking about doing a discussion in October?
And I just think
Yeah.
it'll go from the waterways to the sides of the buildings to sidewalks, and so we might as well
Yeah.
just be prepared to discuss it generally, because that letter, they all kind of,
Well,
it's just
and-
broadly about human waste everywhere.
Mhm.
Right, and I think from our constituents' perspectives, they see this squarely as a public health issue, which I understand it's much more complicated than that, but that's how our constituents see it.
Okay. So you'd prefer to have the conversation here? maybe?
I'm up for discussion on that.
Okay.
I think it's fair
Yep.
to consider that.
Sounds good.
That's true, we could just have a work session if we wanted to.
And we'll shoot for October.
But yeah, it sounds like Natasha knows who to work with and coordinate with, so maybe
Yep.
we'll just. Cool.
All right.
Should we adjourn?
Any other questions, comments? Anybody? All right. Thank you all so much for all your work. We are adjourned.